Hello everybody. The topic which I'm going to discuss is end-of-life care. We know that we would be aggressive in managing whatever we get at Aster Whitefield, but when death is inevitable, or we have a life-limiting diagnosis just made prior, and we've had specific discussions with the family or the family members, and they feel saying that doing unnecessary things are not going to be beneficial. Futility of care. This is something which we all discuss with the family members as well as the patient if the family accepts it. As well as the Supreme Court of India has actually given a clear marking saying that we should have a discussion about all these things, what is futile and what's going to be beneficial for our patients. Now, once we have this consensus, what we talk about end-of-life care could be the last 6 months or active dying phase, which is the last 3 days. Now, during this phase, where the patient would like to be there. Now, is it at the hospital or at home? Most of us, we would actually recommend at home. So to actually enhance this management, a better way of serving the needy, we actually have something called as AsterCare Extended, wherein we actually give the service or provide the service to a large extent in terms of home care services for these group of patients. We'll suggest whatever is to be done for these patients when they're there in the hospital and send them back home, and follow them up, could be teleconsults and others depending upon the patient. If the patient has got severe pain or any other unrelenting symptom which is actually not being managed at home, then they can definitely come back to the hospital to actually manage in a better sense. So to answer your question, is end-of-life care best at hospital or home? We would suggest it at home. We would try all our means to do it at home. If it's not possible to manage them at home, then we would get them back to the hospital at Aster Whitefield. For any further information or clarifications, please visit us at Aster Whitefield.